again, this video is for the people who thinks that first rank is for the people like who have all the benefits, like the
Who
so-called
are studying in the top institute and getting first rank every time. It's not about that.
It's not about that. It's not about that. It's complete. That's what I am saying. I did UG from a private medical college. My father took a loan of 10 lakh rupees to teach me. My family would have told that because I was not earning at that time. You have to imagine on a
Right.
middle class family, your son is getting very good rank. My father is still earning. He is 55 plus. He is supporting you. He is feeding you. If he would have told me that no, this is it, you can't play with it anymore.
If I was there, sir, I would have done that. I would have beaten my son. And you, are you mad?
All around the country, there will be one exam.
Yes, sir.
Wherein
It's the
post,
national level exam.
it's a national level exam. Almost like I think 1,000 plus people write the exam. I was gold medalist in that. But you will be surprised to know that I am not a gold medalist in ND. Correct.
With the patient?
You know what is the meaning of the term doctor?
I'm sorry, sir. I don't know.
I don't know how many of the listeners will be knowing this. You just guess. What would be the meaning of the term doctor?
Healer?
Yeah, it's not. The term doctor comes from a Latin term docere. Meaning is to teach.
I am a doctor. I am happy now.
Yeah. So, what am I doing in OPD? I'm not treating patient. My aim in OPD is to just teach the patient that okay, this is the disease that you are having. We are giving some medicines. That's it.
Okay.
I am not trying to heal the patients. You know what is the primary principle of medicine or being a doctor? Again, healing. It is primum non nocere. The biggest principle of medicine is, or of being a doctor is, do no harm.
Do no harm.
Do no harm. It doesn't say do good to the patients. No. Even if you don't do good to a patient, never do harm.
Right, sir.
So I want to break this myth in medicine that only intelligent fellows will get rank 1. Previously, I used to think like that. That was the sentence that I used. That
Everybody thinks that, sir.
everybody thinks. But that is what I am saying. If you have a passion, if you are clear in your perspective, and if you have the perseverance, nothing will stop you. During my internship, I studied in a private medical college.
Okay.
I studied in a private medical college in UG.
Achha, you are from private?
Yeah. So again, that is what I say. You might think that JIPMER Rank 1 or DNB Gold Medalist I would have done from all the government colleges, everything first attempt. Absolutely no. So again, I told you, again, so many people would be saying.
Your friends were like, अब रेडियो ले ले भाई, डरमा ले ले भाई.
Yeah, so I was JIPMER Rank 1. I could get anything. I could get any specialty that I asked for. But somehow I still remember that day when the last day of sending that application to that. I still remember that day when I told my father that please give me 1 more year. I will prepare. I will crack MD, and then if you want, if I don't get, then I will go.
Hello, sir. Hi, everyone. So this is Department of Podcast, episode 14. And today we are here with Dr. Nidhish Chandra, sir. Sir, welcome, sir.
Thank you, Ankit.
An expert rheumatologist. Sir has done MBBS, MD in medicine, then DM in rheumatology. And we're gonna talk, interesting academic journey of sir and how he has achieved everything. We're gonna talk about everything. But welcome, sir.
Yeah.
So the very first question, sir, I want to ask you, like, if you look at your 20 years back from now, where were you, sir?
Okay. So 20 years back, I was in school.
Okay.
I was doing my schooling. So that time, to be frank, I am the first generation doctor. So no one in my family has been doctor. So I never had this interest, or say everyone say no. My childhood dream was to become a doctor. So absolutely nothing like that. So basically, I was pretty okay in studies. Like I used to come in the first 5 positions in my school. So teachers and all used to tell that you should become engineer or doctor. So that was the only 2 crazy things that were there in this thing. So I was like, okay, TK, exam is there. I have to study well. I have to get some good rank. That's it. That was the only thing. So I was just an above average student,
Okay. Okay, sir.
to be specific for that question, who had no much passion in any of the things. But this was there, like if something is coming up, I have to do good in that. That was the only thing that was there. So
Like if somebody throws you anything, you will manage that.
yeah, that's it. Yeah, that's it.
And
It was not just in academics. Even if we used to be in sports, I used to play badminton, cricket, and all those things. So it was like if I am playing, I should not be bad in that. That was my only
not,
mindset. That's
not
it.
bad.
Yeah, not bad.
Like an average in
Yeah,
everything.
above average, I should say. It would be harsh on me say if I was average. Yeah.
No, sir. You were not average. What I realize now. So let's come to the present.
Yeah, yeah.
And like few years back, you have completed your MD in
Yeah.
medicine.
Yeah.
So I heard, sir, that in JIPMER you got first rank, sir.
Yeah.
So that is the highlight of this session. We'll all talk about, sir. We will talk about the first, how to crack and get that first rank.
Yeah.
Sir, please enlighten us with that.
Yeah. So it actually surprises me also in between, because I was actually the All India rank 1 in JIPMER
Yes, sir.
in November 2017 session. So people might think that, oh, getting a rank 1 is like a big thing, and
It is, sir.
yeah,
Please.
it is. Yeah, it is. I accept that, because I also used to listen to so many interviews of these toppers during the preparation phase. So the thing is that my statement was like, I used to think that getting a rank 1 in the specialty exam is a big thing. But the reality is, you might think that I am JIPMER All India rank 1, so I might be very studious guy, like a bookworm, studious sort of a guy. In reality, it is not the case, because I would say why. Just the exam before this November 2017, I wrote the NEET PG exam.
Okay.
Can you guess what my rank would be? For an All India JIPMER rank 1, wherein 50,000 students, right? I was the topper. So just tell me, just predict what my rank would be that.
I think, sir, you will be under 50, sir.
Yeah. My rank was 10,575.
What?
Yeah.
Seriously, sir?
Yeah. Yeah. So this is what I want to say. I always tell my colleagues, or I used to take some brief coaching classes also after I got All India rank 1. So I will always tell my students, like, medicine is a specialty where your intelligence, where your we will tell this child prodigy sort of a thing, that is not there in medicine.
Okay.
In medicine, it is all about, I would say, 3 P's. First is your passion, second is your perseverance, and third is your perspective. Out of the thing, the second one, the perseverance, is the most important thing. So I would tell you, I told you right in the beginning, the first
Yes,
question
sir.
that you asked, I think it was perfectly placed question. I am a person who in my life thinks that I have to do things not bad. Like, I should not be the best in that, but I should not be bad in that. So right from my schooling, I did not have any special interest like, oh, I should crack medicine, I should get All India rank, but nothing like that. So after my UG, after my MBBS, my parents were, I told you, I was a first generation doctor. So my parents, they had this only thing that, okay, our son is a doctor, he should get some government job. Like for them, like medicine is like MBBS.
Yes, sir.
But
Medicine is MBBS.
yeah,
Okay.
medicine is MBBS. They are not that much academically oriented. Like, sir, yeah,
Little bit. Where are you from, sir?
yeah. I am basically from Kerala.
Yeah.
I am basically from Kerala. My father was working in a public sector company, and my mother is a housewife. I have one younger sister who is 3 years younger than me. So I was from a very middle class background, and that's it. So none of our I was basically the first generation doctor. So coming back to that question. So when I somehow convinced my parents that I had gotten this combined medical service examination. That is that UPSC combined medical service. After the UG, you will be getting posted in railways, army. I don't think it was in army. DGMO in Delhi.
All central institute.
Central institute. So my father was like very happy. Like, this is the end of it. My son has done MBBS. He has got a UPSC job. I attended this UPSC interview. So he was like very happy, and he's like, okay, let's pack the bag and let's go there. So that was the time when I told my parents that no, I don't want to finish with this MBBS. I want to get a MD degree. So they were like, initially they were like super hesitant, because for them it is like a
Everything.
dream job. Yeah,
Everything.
UPSC, getting
Yes,
a
sir.
UPSC job after MBBS is like a dream job. So they told, no
No.
way, no way. You have to join, and then if you want, you can take a break from there and do what you want. But somehow I still remember that day, when the last day of sending that application to that, I still remember that day when I told my father that, please give me one more year, I will prepare, I will crack MD, and then if you want, if I don't get, then I will go. If I get, then I will do MD and then go. But still, I send that application saying that I will join slightly at a later date.
Okay.
So my all my family members were against it, because obviously for them, getting a job is more important than your academic this thing.
Yes, sir. In a middle class family,
Yeah.
government job is everything.
Yes, correct.
And the highest position in India, you can get a government job.
Yeah, and it's a gazetted officer post.
sir.
Your life is settled after
Settled.
that. Like, you get a bungalow, you get servants, you get a car, everything.
Not your life, sir. Whole family life
Yeah,
changes.
correct. So what happened was that, after that, so that was the time when I wrote my NEET PG exam. So my rank was, as I told you, 10,500 something like that. 2016 it was.
16. Okay, sir.
So I told that I want to give one more attempt in NEET PG next year. So I will prepare for that. So my family was fully against me, and at that time I was like 24, 25, finished MBBS, just like that, sitting at home and preparing. So for a coming from a middle class family where I am the first generation doctor, this is not what the family had thought a doctor's life or a doctor's journey would be. They are thinking that, okay, after MBBS you start practicing, you start making money, if you get a government job, that's settled.
Yes, sir.
So it was slightly initially difficult for me to convince my family first, but then, so what I was telling is that, so from that perspective, like 10,500 rank, appearing for another exam, sitting at home idle, like 24/7 I would be at home, I would be eating stuff, earning zero money. So literally it was like a do and die situation for me. So the next entrance that I wrote was the DNB midterm exam.
DNB midterm.
Yeah, that was in 2017 May. So in between that time, my focus was to prepare notes. I joined a coaching center, I made notes and I studied that notes. So surprisingly, again by God's grace, I got a rank of 55 in the DNB All India exam, entrance exam.
Okay.
So
It's like quite a jump.
Yeah. So again, people were telling me, okay, it's done. You take DNB in Gangaram, you take DNB medicine. That's it.
Life is set.
Life is set. But again, my problem is that I am sort of a perfectionist. Like, the problem was that to get a rank of 55, I had not completed the entire 18 subjects. I had completed medicine, surgery, gynecology, all the major subjects, and I had left out all the minor subjects because DNB midterm was never my goal.
Okay.
I was aiming for the next year's NEET PG exam. Okay.
Sir.
So then that is where importance of mentorship comes to your place, because everyone was saying that you got a very good DNB rank, take. But my mentor there at Thrissur, I studied there at Thrissur, he told me that no, your aim should be NEET PG. He did not say that DNB is wrong or anything. What he told was that, did you give your best for this exam? I told no, absolutely no, because I am just halfway through. So he told that, since you are only halfway through, continue your studying this thing, give the next NEET PG, and whichever rank you get, you take it. So that was when I was thought that, yeah, it's right, because my aim was something else, and in between I got a good thing. If I settle by that, then I won't be, again, I will be compromising my whole life.
Yes, sir.
So that is where the P comes, perseverance. Like, if you aim for something, never stop at that in between. Wow. And I was always passionate about what I was doing. So that is the first P. So first is, you should be passionate about what you're doing, and perseverance. Don't stop until you get there. Now you're telling me JIPMER rank 1. If I would have settled for a CMS job, I would never have been JIPMER rank 1. If I would have settled for the DNB midterm exam, I would never have been JIPMER rank 1. So JIPMER rank 1 doesn't mean that I am studious, I am top in all the things. It's absolutely nonsense. So it's all about your passion, perseverance, and perspective. See, my friend who got a DNB 75 took radiology in Gangaram, and now he's doing pretty good. So
Yes,
that
sir.
was his perspective. My perspective is something different. So never settle for someone else's perspective. So that is the third P. So if you have these three P's, you will realize that nothing is difficult for you. So that is why now looking back, now I feel that I got JIPMER rank 1 because of my these three P's rather than being a super intelligent fellow who is first at everything. No, just uh, things, there might be so many things that might be happening around you, but your focus, your vision, if that is driving you, then you don't need to think about the environment. You will reach there.
Dream it, visualize it, and then
Yeah.
work for it.
Yeah, exactly, and not settle for less. Like
No.
if you have, for example, so then what happened was that I got this DNB rank at the same time I got JIPMER rank 150 during the mid JIPMER.
Okay.
Yeah.
So you wrote the JIPMER exam twice.
Yeah, JIPMER exam used to happen twice in a year. So in the mid exam, I got DNB rank 50 and JIPMER rank 150. So again that same thought process comes. Your friend would be coming, "Arey yaar, join kar lo. You got a rank 150. You will get surgical specialty. You will get MD, all the paraclinical. Clinical subjects we
Yes, sir.
usually it was slightly tough. So again, I had emergency medicine was a subject that I really wanted to take. I still remember on the last day of filling the JIPMER this thing, I called my friend who is working there in emergency medicine. I asked him, how is emergency medicine department? So I still remember his statement, is emergency medicine your dream specialty? I told no. Just because I got this rank, I'm thinking. Then he told no, don't settle for it because MD emergency medicine is a new specialty. So it is very good, but it will take some time to this. But since it is not your priority, don't settle for it. Write the next JIPMER exam. I am sure that you will get a better rank. So that is why I didn't fill the last day counseling this thing for JIPMER. Then I started studying. Then when the NEET PG was about to happen, JIPMER exam happens 1 month prior to that. So I wrote JIPMER exam just for a what to say, just like a trailer for the this thing trial. So then I wrote the JIPMER exam.
It was like grand test.
Yeah, it was like grand test, to be precise. So then I got the JIPMER rank 1. Then you won't believe I didn't write the NEET PG next year. Because the reason why I didn't write NEET PG is because I got JIPMER rank 1. So again, I don't know. Next question would be, I don't know. Why you chose medicine?
Yes, sir. Yes, sir. I just wanted to ask that.
Yeah. So I got JIPMER rank 1. So again, there was confusion. Like I got JIPMER rank 1.
Why medicine, sir?
Yeah. Why medicine? Yeah. So again, there was. I told you, know. Again, so many people would be saying.
Your friends were like, अब रेडियो ले ले भाई, डर्मा ले ले भाई.
Yeah, so I was JIPMER rank 1. I could get anything. I could get any specialty that I asked for. Yeah.
6-year course is also there, I think, in JIPMER.
No.
Okay,
JIPMER doesn't have 6-year course.
Okay.
This thing. So again, so my passion right through UG was medicine. So I am a person who likes to communicate with people. I am a person who likes to speak to my patients. I am not a techie freak. I didn't have any yeah, sophisticated mobile phone, anything. Basically I was technology retarded.
Okay.
So I did not have that much of exposure. So everyone told me, as you told, radio lelo by life is set.
Yes, sir.
You will earn in lakhs. So I was also thinking, okay, that is also a good option because if money is there in front of you, if you have anything, why not go behind money and the market value? That is a term that
yes, market value.
Go behind that. But then I thought from where I started, because during my internship I studied in a private medical college.
Okay.
I studied in a private medical college in UG.
Achha, you are from private?
Yeah. So again, that is what I say. You might think that JIPMER rank 1 or DNB Gold Medalist, I would have done from all the government colleges, everything first attempt. Absolutely no.
My goodness, this is huge.
So I think, yeah, that's what. So if you want to put a thumbnail, it will be like breaking the myths.
Yes, sir. Yes, I am going to do that.
So if you put the thumbnail like I am JIPMER All India rank 1, DNB Gold Medalist, DM Gold Medalist, people may think that I am everything first attempt, everything from government college. Absolutely not. I did my. Can you guess what would be my NEET UG rank? 1, 2, 3. What? Can you guess?
I think, sir. I can't guess, sir. I can't guess.
You might guess a 2-digit rank.
Yes, sir. Yeah. Yes, sir. Yes, sir.
My NEET UG rank, that was state rank, was 2,100.
2,100.
Yeah.
State rank.
State rank.
Okay.
It's a state rank.
Yes, sir.
So as I told you, I did not have this passion that I would do medicine. No. So during that time, I had written both engineering and medicine. So I got a better rank for engineering.
Okay.
So I went to a private engineering college because less than 3000 rank, that was a pretty new college. So they gave 100% fee waiver.
Okay.
So I joined mechanical engineering at a private engineering college.
Okay. Now this is interesting.
Then what happened was that was a time when our state government had a bond with the private Christian colleges that they should give 10% of seat to the government.
Okay.
So then usually our state colleges, our this thing gets over by 1200, 1300. But that year, because of the special tie with the private Christian colleges, they increased the number of merit seats.
Okay.
So that was when at the last round I got allotted to a private medical college.
My God.
Yeah, so,
The dice of luck.
Yeah. So
rolls
again,
in your favor,
yeah,
sir.
Yeah. So again, my family was, I told you, like my family had one engineer in my distant relation. So my parents and my grandparents were very eager that I should become a doctor. But I had no real interest. So they convinced me. So I thought that it's a private college. The fee structure used to be like 3 lakhs per year.
Yes, sir.
So whereas in an engineering college, you see, I would be like a king there because I don't need to pay anything. So I was always inclined towards engineering because it was free. There is no pressure. I can do whatever I want. Nothing like that. So again, my family convinced me that okay, you don't worry about the money. We'll somehow manage it. You just go and do whatever you want, like you study. My family was always supportive in the sense that they never pressurize me. They just tell me once and then they leave it to me.
Okay.
So
the
just
choice
like
is yours.
Yeah, choice is made. So just like the CMS thing, if they would have pressurized me to join there, I would have joined there. My life would have ended there. So they were very. I'm still fortunate to have parents like that who don't pressurize. They will just tell this thing that don't worry about money. We'll arrange the money. You do what you want. So I joined medical college, and I was into arts, sports, and all these things. I was never a topper in my batch. In any of the professional years, I was never a topper. But I used to come in the first 10. We had a batch of 100, so I used to come in the first 10. So I was into sports. I was in the badminton team. I was there in the football team. I was there in the college union. So college union secretary is like you have to run around. You have very less time to study. But I used to somehow manage studies on the side. I used to be in the first 10 ranks. That much I would say. But no one ever imagined that I would get such a top rank in JIPMER or anything. They never used to think, but they knew that okay, he's a good.
Even if I was studying with you, I was like, no, somebody else is there. He's not there.
Yeah, because you won't remember. We have ours was the first batch in Kerala where we had a single university. Like we have a university called Kerala University of Health Sciences. So that was the 2010 was the year when they integrated all the universities and there was only a single university. Okay. So in my batch, two people got top two ranks in the first exam. Okay. There was two girls who got distinction in their first year, like anatomy, physiology, biochemistry. Yes, so they were like the most sought after two girls because getting a university. So she was a gold medalist in anatomy and biochemistry, and the girl who got second rank was the gold medalist in the third subject. So like the whole college used to praise both of them. So
they were the poster person of the college.
So we were never there. So I was like a jack of all trades but master of none. Yeah.
And you were really like, wow, look at them.
Yeah.
They are.
So yeah, I used to think like, oh, they are like super. So there was absolutely this getting a rank one or a gold medal was never in my dream also, because I used to see how much they used to study, how much they used to prepare and everything. So that was not there. So on a lighter note, that pressure never used to be there. Like you need to be there. Okay. You just do what you want to do, and that's it. So again after my why I was telling you this is during our UG time, during our clinical postings, we had very good faculties there. Okay. The sad state of affairs now is that now students, just because of getting a dream branch in their MD, they don't attend clinics properly. They just sit in library, they just watch videos and they just learn. The sad part of is they lose on so many important things. Like the only reason why I chose medicine over radiology is because we had very good bedside teaching. We had very good professors who used to enlighten us at the bedside, which I am sure that none of the medical apps will do.
Yes, sir. Yes, sir.
Because I still remember the first time when I saw JVP, that euphoria of seeing a clinical sign and diagnosing a cardiac failure. That is what I am saying. Radiologist will disappear by next 15-20 years, but clinical medicine will never die.
Never.
Clinical medicine will
Nor
never
the
die.
clinical medicine, nor the surgical
Yeah,
specialties.
yeah, it will not die because that is the beauty of clinical medicine. So I used to get fascinated by that bedside teaching and bedside this thing. So this was the thought that came to me when I got all India rank 1. If I would have gone behind radiology at that time, I would have left behind my passion. So
Okay.
that's what.
So the passion developed from your seniors
Yes,
and
yes.
how they taught you
Exactly,
in your
exactly.
MBBS era.
Yes, exactly. So that private college that I told you, we did not, we had very less few PG seats.
Okay.
So in my unit, I was working as a PG as well as an intern.
Okay.
So I used to collect sample, I used to present cases, and I used to present it to my senior consultant.
Yes, sir.
So I used to do all the jobs. So it was like internship was like a PG first year for me there. So at that time, if I would have bunked all those things and I would have gone and sit for entrance, I would have gotten entrance maybe in any of the colleges. But see, working towards your success, enjoying that process is something different. Like I could have gone and sit in a library and studied and got into this thing, but I took 1 year break. I did not get a good rank in first attempt, so I took a break. But I made sure that 1 year of that internship, I used to work a lot.
Okay.
Because my focus was like, if I do something, I have to be good at it. So that's why when I used to go to surgery, my surgery professor used to tell, you work well, you come back to surgery. When I used to go to even gynecology, my gynecology professor used to tell, you are good in this, you come back to gynecology. So that is what I feel, that if I would have focused on the result, like getting a rank in this thing, I would have enjoyed so many things that I used to learn in internship. Because I feel that difference now. Because now after MBBS, people are like, no, I want to get a good rank in this thing. When I become internship, when I join JR1, I will study from there. That is not what you are here for.
Yes, sir.
Like simple example, I will tell you, Ankit. You are going in a flight, some emergency happens, you are doing an anatomy, you've done your anatomy.
Yes, sir.
If some medical emergency comes, what is the first thing that they will ask? They will ask, is there any doctors
Doctor.
in flight?
Yes,
They
sir.
won't ask, is there any MD medicine in this thing?
Yes.
So you can't go there and tell that I have done MD anatomy, I don't know how to do a Hemlick's maneuver.
Yes, sir.
That is not acceptable.
No.
Because
Absolutely not.
absolutely no. You are going back to your village, there is a delivery that is going on there. The villagers will come to you and ask, come to take the delivery. You can't tell that I have done radiology, I don't know how to take delivery.
Yes, sir.
That is the sad state of affair that is happening now. Because after MBBS, people are just focused only on the result.
Right, sir.
They don't go for postings, they just sit and study the entrance app, and they miss out on so many things. Simple question: does it matter if you become an MD anatomy fellow at the age of 32 or 38? Does it matter?
No.
No. It just matters after you finish MD anatomy how good you are.
Yes, sir.
It
Absolutely.
doesn't matter 1 year whether you are earlier or not. Absolutely, it doesn't matter.
No.
So why are people so worried that I should get MD at this year?
Okay. Outside India, sir, like people like in Europe and in US, the average age of people getting into medicine is 35.
Yeah, correct. Yeah,
Not
correct.
average is more than 38 or around.
Yeah.
But starting age is 35.
Correct.
So, and people are like more focused on the clinical setting and making them like they're ambitious.
Correct.
If I say correctly.
Correct.
But in our settings, like I was also like in pressure. Everybody gets in that pressure.
Correct.
We are in like, nahi, pehle degree chahiye. I want that degree. We need that degree.
I will tell you an interesting story. I have been
Yes,
to
sir.
Australia for a conference. Actually, my wife had gone there.
Yes.
I was also there. So we met one interesting lady. She is an Indian born. She is also from a very middle class family. She had done some arts or something, BSc or something. Then her something bad happened with her family. So you won't believe, from an arts background, just because she had passion in medicine, after moving abroad, she did training in physics, chemistry, biology. She wrote an entrance. Then she wrote a UG entrance. Like it is like taking to convert it in Indian language, she did maybe just imagine that she did commerce.
Okay.
And
Okay.
she did her basic degree.
Okay.
Then she thought that she should become a doctor. She again went back to +1, +2 online classes. She learned physics, chemistry, biology. She cracked the +2 exam. She cracked the UG exam, and then she became a doctor eventually. And now she is a pediatric endocrinologist.
Wow.
That is, she started preparing for physics, chemistry at the age of maybe 24 or 25.
Okay.
So now she is a leading pediatric endocrinologist in Australia. So it is that what drove her there. What was a need for her to pursue medicine at that point of time?
I don't think so.
It's passion.
Yes, it's passion.
It's just passion. Now at the age of maybe 50, 55, who is asking when did you get your degree? No one is going to ask. No one will ask. So ultimately, and they have a very good work-life balance there. They don't run behind this degree, money. No, it's always a balance that is required in life.
Right, sir.
So it's all about your perspective. If I would have joined retrospectively, if I would have joined a CMS degree at that time, I would have been happy. I would be happy now. I would be earning in lakhs. I am a guested officer post. But the problem is that I am a person who likes to do things on the go. Like I don't like to sit quiet in a room and all those things. So I might not be happy in that position, whereas someone else might be happy in that position.
Yes.
So I should not try to put their perspective into my life or my perspective into their life. The only thing is that you have perspectives everywhere. It's upon you to choose which one you want, but never choose any decision based on what others feel is more important for you. Like exactly, if I would have chosen radiology, I am 100% sure that I would not have been happy, because I am a person who likes to talk with the patient, who likes to convince patient, who likes to interact with them. How can I be happy with machines? From morning to evening, I am just doing ultrasound, this thing. There is no passion in that. Whereas someone else might be more interested in enjoying it. So they can't force me that this is better. It's up to me to choose which one is better. Right, sir. So I want to break this myth in medicine that only intelligent fellows will get rank 1. Previously, I used to think like that. That was the sentence that I used. That
everybody thinks that, sir.
Everybody thinks, but that is what I am saying. If you have a passion, if you are clear in your perspective, and if you have the perseverance, nothing will stop you. And medicine, I would say, I don't know if many people agree with this, medicine is a specialty wherein you require very less intelligence.
Okay, this is the first time I'm hearing this. I don't think so. Personally, medicine is like literally tough, sir. Harrison is like the lot of everything.
No, I completely object to it.
Okay.
Because you know how residency works in JIPMER. In JIPMER, in the first year, we used to do 36 hours duty. 36 hours duty.
Now let's come to Sir JIPMER.
Yeah. So I got into JIPMER, I got rank 1. I was convinced that I will take medicine only. I joined medicine. So the reason why I didn't write NEET PG at that time is because I was so frustrated with the workload there that I didn't have time to again go back and read and then again up, because there used to be a gap of almost like 1 month.
Yes, sir.
So people again used to tell me that leave JIPMER because JIPMER is very toxic, write NEET PG, get a state medical college and just your life will be settled. Because in JIPMER, the problem with the institute culture is that their work will be very toxic.
Okay.
It used to be toxic, and it used to be like 36 hours per day, continuous shift, and there is high academics, research, everything is there. So barely we used to get, I used to sleep once in 2 days for almost like 6 to 8 hours. That's it.
Seriously?
Yeah, seriously. So I used to go to my hostel only after 36 hours of duty. I used to sleep for maybe 6 hours or 8 hours. That's it. So that was the reason why, because my head of the department asked me first question, do you want to write NEET PG exam or not? Because if you are planning to join NEET PG exam, then better leave JIPMER and go out. So on the first day itself, I told him, no sir, I got a good rank, I chose medicine, I will stay here only. Then he told that, okay. The reason why he asked the question is because people who write NEET PG after JIPMER, they eventually leave JIPMER and join the state medical colleges. Yes. So I opted not to write NEET PG because I thought that, okay, this is it.
And you knew that toxic culture was there before you were joining?
Yeah. I was ready for it. Ready for it. So what happened in JIPMER was that first 6 months was like really hard. Like it was like work. It was like hell. But still, as I told you, I am a passionate person in medicine and I love working. So that is the reason why I could survive there. That is again more important. If I would have chosen a specialty that was not my passion, and if I would have chosen something like you say market value,
yes, sir,
I would have definitely left it and gone. So again, it is important that whatever toxic culture is around you, if you are passionate in what you are doing, you will not leave it.
It's like if you want it, you will go through hell to get
Yes,
it.
yes, that's it. That's it. So, because that is a basic law, like if you are passionate about what you are doing and that gives you happiness, that gives you money. One more interesting thing in JIPMER is that the salary used to be like very crazy. It is one of the topmost paying centers for UG, for PG, sorry. We used to get almost like close to 1 lakh as stipend.
At that time.
At that time. Because in state colleges, we used to get around 40-45,000. But the life used to be slightly easier there.
Easier.
So that is what again I am saying. If you are passionate at doing something and that passion gives you happiness, that passion gives you money, then do it. Why are you going to do something that is not your passion just because it gives you money? There are other professions for that.
Right. Sir.
You can do trade marketing, that will give you money.
You can come on YouTube and make videos.
Yeah. But that is what. See, Ankit, your passion is YouTube. You are doing this.
Yes, sir.
I'm
happy.
Yeah, and you're happy. Ultimately, that is what I would like to say. I've been to conferences like almost like to 4 countries. That is what is different between Indian doctors and people who are outside.
Okay, so what is the difference, sir? What is the mindset?
Exactly. Their mindset is like they need happiness in their life. They need happiness in their life. Suppose if you are interested in making YouTube videos, you make YouTube videos. The system will provide you that ecosystem to make videos. You will get paid for it.
Okay.
You will get paid for it, for the passion you are showing. And it will be like 5 days a week. 2 days is completely for your family. So you are happy with your family. You are happy in the whatever work you are doing. And the institution is paying you for that. What else do you want? Here, what are you doing? You are a senior resident. You have to do your administrative work. You have to do your teaching work. You have to find time out of this and invest in this.
Right, sir.
What is the thing that you are earning? Nothing.
Nothing. I am earning nothing.
Nothing. Whereas if you go to outside countries, they will select you for the passion you have. What does the institute want? If you were in some outside country, what they will do is, oh, this fellow Ankit in anatomy is very good in making YouTube video. Let's hire him. Next time when
Combined it with
next time when a university program come, let Ankit handle the technology stuff. We will pay you for it. Relieve him of all the teaching and all these things, because that is not his passion. He is good at something, so make him do what you are good at.
Okay, that is like brilliant.
Whereas in India,
and I can give like 200% in
exactly
this because I'm like crazy for this.
Exactly. And you get paid for that also. Exactly. Now, coming as a doctor, I am interested in research, I am interested in patient activity, I am interested in academics. Here, what happens is that I have to find time from my busy schedule to do passion to do my passionate things. I don't have any extra allowances for that. I don't have any extra time for that. It is just because of my passion that I am doing research.
Right, sir.
Whereas there you prioritize. There you prioritize what needs to be done. Only 2 days per week for OPD, 2 days for research, 2 days for academics. That's it. Whereas here, in these 6 days, you have to accommodate everything.
You have to do OPD every day.
Yes.
You have to do research. It's your own time.
Yes. So why I am telling this is, here the ecosystem is such that there is toxicity already there. On top of that, if you are doing something that is not your passion, how you will be happy? Suppose I have chosen radiology in JIPMER. JIPMER radiology is like very crazy for the first 6 months. You will be having night duties. It's not like the radiology that you see outside.
Okay, sir.
You have night duties, you have reporting. It's very hectic there. So how can I work in that ecosystem
if you're not passionate about that?
Exactly. So the reason why I told you is that you told Harrison is the biggest thing. No, whatever medicine I have learned now is from my patients. Suppose I see a patient with myocardial infarction. During our duty days, we used to at least have 5 to 10 patients with myocardial infarction. You treat the patient, you learn from the patient, then you go back and read Harrison. Harrison becomes so easy.
Okay, it's I'll say retro.
Yes. Whereas if you sit and read Harrison, like, okay, today I'm going to read myocardial infarction. No, that is not how the medicine works. Medicine is taught from the biggest teacher is the patient.
Yes, sir. I'm gonna interrupt you one more time. So
Yeah,
sorry,
okay,
sir.
no issues.
when I teach anatomy, sir, I love to teach from the patient perspective.
Correct.
First, I introduce a patient, or make them watch a video of some clinical scene, and be it of any YouTube videos or any episode from Doctor House or anything, and then I teach them. Like, first I create an interest by seeing the patient, because ultimately we have to treat the patient.
Correct.
It is for the patient.
Correct. Correct.
With the patient.
You know what is the meaning of the term doctor?
I'm sorry, sir. I don't know.
I don't know how many of the listeners will be knowing this. You just guess. What would be the meaning of the term doctor?
Healer?
Yeah, it's not. The term doctor comes from a Latin term docere. Meaning is to teach.
I am a doctor. I am happy now.
Yeah. So, what am I doing in OPD? I'm not treating patient. My aim in OPD is to just teach the patient that, okay, this is the disease that you are having. We are giving some medicines. That's it.
Okay.
I am not trying to heal the patients. You know what is the primary principle of medicine or being a doctor? Again, healing. It is primum non nocere. The biggest principle of medicine is, or of being a doctor is, do no harm.
Do no harm.
Do no harm. It doesn't say do good to the patients. No. Even if you don't do good to a patient, never do harm. That is the principle of medicine. If there is a medicine that has got a side effect and has got a, that is why we come regarding this risk to benefit ratio. If the risk is more than the benefit, don't give the drug.
Yes, sir.
Whereas if principle of medicine would have been do good to your patient, you would surpass that risk and you would think of benefit and give the medicine. No, that is not what the science tells us. It is do no harm. Even that is what is called as passive observer. Sometimes in medicine ward, you know that the patient is going to die, you might not be able to intervene because you know that the risk of intervening is more than the benefit that you are going to give to the patient. So be a passive observer. There are conditions wherein you can't do anything to the patient. You have to accept that. Just on the drive that you will try to do, you like save lives. No, that is not how our science works. Our primary principle is do no harm to the patients, because our body has got that power to do magical things if on along with the medicines that we are giving. You don't need to something supernatural, you don't need to do something supernaturally, you just follow what your science says.
Right, sir.
So that's it. So that is what again I was saying. So patients are the teachers. Patients will teach you. If I see 5 to 10 myocardial infarction patients, then I go back and read Harrison. Harrison becomes clear. Then you will realize that, array, this is what the patient has taught me.
And you will, sir, imagine everything. Everything everything forms a line and easily
Correct.
gets you.
Whereas retrospectively, now what is happening is that students are reading myocardial infarction on Harrison and then going back and applying it. No. In internship though, which medical college will not have myocardial infarction patients?
Every because
As an intern, go to ward, see myocardial infarction, come back and read Davidson, Harrison, internet. It becomes crystal clear.
Right.
Rather than going and reading first and then going and seeing patients, oh, I have read it somewhere, करके याद आएगा. It's not how things work.
You utilize this method of learning in my residency here. Eventually, I didn't want anatomy at when I was choosing for this branch for NEET PG counseling. But I saw KGMU, then I chose like, let's go for the best institute in the branch. So I chose this. But on my early stage of learning, I didn't like learning because anatomy is vast, sir.
Yeah.
So I started dissecting. First I dissected, I explored like a pirate, and then I used to read. Then it was like, okay, this path I can work with myself.
Correct. Yeah. So that's a way of learning.
First see patient, then you go and learn.
Yeah, correct. So that is what. So you might be listening. I got the JIPMER rank 1 in the MD JIPMER fine legs. I'm talking about. I have done 3 years of MD. I was good in my patient care. All my consultants used to like me, but I was never the topper in MD. Like out of the 10 people in my batch, I was never the topper.
Okay.
because there were people who were better than me in academics, in patient management, everything. But I had this patient-centered approach. So I am a DNB Gold Medalist. DNB Gold Medalist is like after MD or maybe people who are doing DNB, all around the country, there will be one exam.
Yes, sir.
Wherein
It's the national level exam.
it's a national level exam, almost like I think 1,000+ people write the exam. I was gold medalist in that. But you will be surprised to know that I am not a gold medalist in MD. How
Okay.
out of
You are at the national level, you are a gold medalist, but in 10 people, you are not the gold medalist.
So exactly, this is what I want to say. There
And sir, sorry,
yeah,
that is much more tougher than your
but exactly
university exam.
Yeah, exactly. But that is what I am saying. The pattern of both the exams are completely different. In MD, we have a more like a theoretical stuff in our theory paper. Like they will be. I still ask. I still remember there was a 10-mark question on that year's Nobel Prize winner.
Okay.
So I had absolutely no idea what is that. Whereas in DNB exam is a much more structured approach. They will be their first question I still remember is like an approach to a patient with breathlessness and swelling of lower limb. So then you have to think from the bedside, like a patient is coming to you with swollen limb and breathlessness, whether it could be pulmonary embolism, whether it could be cellulitis, sepsis, septic shock, then you think from a physician perspective. So I always found that exam pattern suited me more.
Okay.
So I hope you are getting it. So
Yes, sir.
it doesn't matter whether you are first in an exam or this thing. Like you always stick to where you belong.
Stick to basics.
Yeah, stick to basics. So that DNB exam suited me. I was more of like a patient-centered approach I had during my MD. So that is why I got DNB gold medal. It doesn't mean that I am best. So again,
no, it means you are the best, sir. It doesn't mean you are not the best. It means you are the best.
Yeah, so again, that is what I wanted to say. My colleague who got MD gold medal, I still consider that she is the best because I know the toughness of that JIPMER exit exam is far, far more than the DNB exam.
Okay. Okay.
Okay, so getting a rank one, being a topper doesn't mean that you are the best. There might be so many people who are better than you, but might be getting a lower rank than you, who might be equally good or more, who might be better than you. So it just means that on that day of exam, the 10 questions that came you suited you, you wrote that well, and you got the rank. That's it.
Okay,
It
sir.
is. That is what I don't believe in overnight successes. If you have, I don't know if whoever listens it, they should get this fact that all these ranks, all these medals, all these things, don't think that it is for the best people. No, nothing like that. You do your work. If the exam suits you, then you will become the topper. That's it. It doesn't mean that I have to be the best to get a gold medal or rank. Nothing like that. You do your work, but put your heart soul in it. What you do,
What?
be passionate in what you do. You will get the result ultimately. But only thing is that perseverance. Like if you don't get it once, and if your circumstances allow you, and again I am saying the reason why I could get a good rank in JIPMER is because my family supported
Yes,
me
sir.
for the 1 year. See, midway I got a DNB rank of 50 odd.
50.
If my family would have told that, because I was not earning at that time, you have to imagine on a
Right.
middle class family, your son is getting very good rank, my father is still earning, he is 55 plus, he is supporting you, he is feeding you. If he would have told me that no, this is it, you can't play with it anymore.
If I was there, sir, I would have done that. I would have beaten my son. And are you mad?
Exactly, because the entire people around him were like asking, what is
Why?
your son doing? Arey, he got a 55 rank, he's not joining, what is this? Has he gone mad? But my father always had belief. My mother and father had belief in me. They told me, if you feel that you are not yet studied fully, you want to study full and give it an exam, give it a try. Don't worry about the financial background, we will manage it. Financial background in the sense, I am not coming from a very rich family. My father's salary used to be in 10,000s or 15,000. Matlab, he barely managed to pay the rent of the house and take care of the household and everything. That's it.
Okay.
So
From coming from that thing, you stayed 1 year like jobless,
jobless.
and you studied for it.
Yeah. So again, this video is for the people who thinks that first rank is for the people like who have all the benefits, like the
Who are
so-called.
studying in the top institute and getting first rank every time. It's not
It's
about that.
not about that. It's not about that. It's complete. That's what I am saying. I did UG from a private medical college. My father took a loan of 10 lakh rupees to teach me during my UG, and he gave me the freedom to study sitting at home for 1 year. So my only job was to study. I could have stopped midway, but my parents were so they gave me that freedom to do what I felt was this thing, and I wanted to convince them. That's it.
So this is also for the parents who are listening.
Yeah, exactly.
And to give your child or son or daughter the freedom to get the best out of them.
Exactly.
And trust on them.
Yeah, trust. And the thing is that I always used to replicate those trust, because from a 10,500 odd rank in the first NEET UG, that the exam that I gave 50 rank came. So that parents had the belief in me that ठीक है इस बंदे से हो जाएगा.
That was a drastic jump.
That was a drastic jump. But the effort that I put in between, that is more important.
Right.
See, getting a 50 odd rank in DNB will not come to you overnight. So that 6 months from November 2016 exam till the mid DNB exam, daily I was putting in my amount of hard work.
Right, sir.
Because I knew that my parents are earning, I am sitting at home and doing nothing. I can't waste my time. So my only thing is that I have to at least convince my family that I am studying wholeheartedly.
Okay.
So that they will convince that okay, he is doing his part. Let's see how the result comes. So that is more important. So that is what again I say, perseverance. That's what I told you. I am not a gold medalist in any of the university exam. I did not get a very good NEET UG. So that is what I would like to highlight here. I don't want to highlight on all the firsts that I've got in my life. I want to highlight on all the lows that I have been to. Because a successful person is not who gets overjoyed in all his ambitious projects and all. No, a successful person is one who learns how to get back from a failure.
Right, sir.
Because that is more important. Because when success comes, it's very easy for you.
Yes, sir.
Everything is easy.
Everything is like dream.
Yeah, but when a failure comes, how to get out of that failure, that is more important. And always don't get dejected by the failures. So that's what. So the thumbnail which you put today should be breaking the myths. It's not like getting a rank one, getting a gold medal is everything. No, no one sees the other side of it.
Yes, sir.
No
one talks about the the hard work you have put into that.
Yes.
And how many failures you get before you reaching on the top.
Exactly. The Women's World Cup, Jemima Rodriguez, in her speech she cried. She showed her emotions. She told that I have an anxiety disorder. How many of them will have that bravery to come out and tell? That speech like ignites the youth. See, in all the YouTube successful videos, in all the YouTube things, you only see successful people. They often don't tell about the hardships they have faced through. They don't tell about the mental agony that they have been through. So on the other side, when students are listening, they will feel miserable. Like they will be feeling like, oh, I am not able to reach there. People are getting there. So this interview is for those people who want to succeed in life but are not able to do that. The only thing that I would like to say to them is be passionate, have perseverance, have faith in yourself. Convince the people around you, convince the family that you will do it. But if you are not able to do it at multiple times, like first time you are given, not able to do, second time, then settle for something that suits everyone. Because it is absolutely, for example, if I would have got a decent rank in the next NEET PG, I would have settled for that, because I can't allow my family to work for me again.
Yes, sir. Yes, sir.
Because it would be completely foolish from my side if I get a 5,000 odd rank in the next NEET PG and I will again go to my parents and say I want to sit one more time. One more. That is not logical.
That is like putting a lot of pressure on your family.
And on yourself.
On yourself, yeah. You have to go that rough patch again for a year.
Yes. So in that case, settle for less. Because See, that's what I'm telling. The third P, it is passion, perseverance. Third is perspective.
Right.
So
Change your perspective.
change your perspective. You are aiming for a good rank, good medicine. Change your perspective. Because happiness can be earned in life through various means. It doesn't mean that you have to be in the top college, nothing like that. See, that's what I'm saying. Doing an MD, doing DM, you tend to see different kind of people. Like example is you. You have done MD anatomy.
Yes, sir.
Person who has got a decent rank would tell that, अरे MD anatomy लिया है, छोड़ दो वो कुछ काम का
कुछ
नहीं
काम का
है.
नहीं, बिल्कुल.
It's not about that.
Yes, sir.
You can excel in MD anatomy. You can become a very good successful YouTuber, and you can earn more than a radiologist.
Right.
So how you become inferior in that? No, it's that passion that drives you. See,
I love teaching, sir. I love anatomy.
see, that's what I'm saying. Next year, now you are having some 1.2K subscribers or so.
Yes, sir.
Next year, touch wood. Who knows? You might have 1 million subscribers. Whereas a radiologist who have joined top medical college along you will be still earning 1 lakh per month. You might be earning 10 times more than him. So
Right,
who
sir.
is more successful?
Of course, the greater the money.
Yeah. So it is not success that others think about you. You need to think where you need to be.
Like, it's my vision, it's my perspective.
Yeah.
I am happy in like 5 lakhs and doing radiology. I am happy in that. It is success for
Yeah.
me. If I am doing anatomy and I am earning 1 lakh, it is success for me if I am happy in that.
Yeah. Correct.
It's like your own perspective, right, sir?
Correct. It's
Like,
the three P's. Like you should have the passion, you should have that perseverance to do that, and you should have that perspective, and that should be your own perspective. It
right,
should not be like someone else's perspective and you are working towards that. No, nothing like that.
right, sir. Now, sir, let's come to one more thing to ask, sir. Like, on your preparation phase, where you were preparing, so did you like completely dependent on, were you completely dependent on coaching centers, or did you like prepare by your own?
Yeah, to be frank, during my NEET PG preparation, I had taken 1 year break. So that is the first thing that I would say. I am not a first timer. Okay, so you might think that, oh, JIPMER rank, oh, no, I'm not a first timer. So I had 1 year of preparation wherein I sat at home and only prepared. So I had basically two strategies. My first strategy was to get grip of all the subjects that is being asked. So my 12 months I had split into 6 and 6. The first 6 months is entirely on making notes for the subjects. So for that, yeah.
Okay, you prepared your own notes.
No, I attended coaching class. I was affiliated with a coaching class called NEET PG that was run by my own faculty in the college. So I used to go to their classes. I used to make notes. I used to add on to the notes, and I used to make my own notes. But my primary base was from that coaching class only.
Right.
So I used to make notes. Then after 6 months, I attended a test and discussion series wherein I used to do test and discussion series, and I used to make so many mistakes. I used to be, I think almost like 10,000 odd people used to appear in that. Initially, when I started appearing, my rank used to be 1,000 plus. So what I used to do was that my greatest advantage is that I have a baseline notes. So I used to attend test and discussion notes. I used to fail miserably in that, but again, revision. The mistakes that I used to make, I used to go back and add to the notes. So each test I give, my notes became stronger. So I used to be so fascinated to write exam, not thinking about the rank. I used to make as many mistakes as I could so that my notes become stronger. Example I will give you. For example, I write a question. I just randomly I made a guess and that became right. My mindset will be like, oh, I made it right, so don't go back to it.
Yes, sir.
But if I would have made a mistake in that, then my mind will say that, oh, you made a mistake, you have to go back to it again. So I will add that point into the notes. So my humble request would be make notes, attend a test and discussion series, make as many mistakes as possible before the exam.
Okay.
Because that's what I have learned in my life also. Making mistakes is that will teach you more things.
That is absolutely necessary.
Yeah, that's what failures will teach you more things than success.
Right.
So make so many mistakes, add to your notes. It's always important that you have to always update your notes. So first session was on making notes, others was on test and discussion and adding to your notes. That was a strategy that I used. And then always spend at least 1/4 of the time for revision, because your rank will be decided based on your revision strategy. That's it. So first make notes, do test and discussion series, then find time for revision. That will be it. You will get a decent rank, that I can assure you.
So let's talk about, sir, why DM Rheumatology?
Yeah, so after my MD medicine, I had absolutely, I thought that I will stick with MD medicine, because I am sort of like a medicine oriented person. My passion was always medicine. So I thought that okay, I will stop with MD medicine. But then again, my seniors, everyone who have settled with MD medicine, they told that on the long run, super specialty will take over the field. Like if you have an abdominal pain, you will go to a gastroenterologist. If you have a chest pain, you go to a cardiologist. So now the scenario is changing. So I thought that I will do a super specialty now after my MD, and then I will practice as an internal medicine physician.
Okay.
Okay, because there were some of my professors who used to be a neurologist, but they used to practice medicine only. So I wanted to take a specialty that is more linked to medicine, so that I will not lose that grip of medicine. So I had two options. I had nephrology and rheumatology, where I thought that it is more close to medicine. Suppose, for example, rheumatology, SLE. SLE is a multi-system disease.
Right, sir.
Sjogren's syndrome, it's a multi-system disease. Scleroderma, it's a multi-system disease. It can affect anywhere. So, see, in our OPD and in our ward, we are managing patients with pneumonia. We are managing patients with renal failure. We are managing patients with lupus, with neuropsychiatric lupus. That is like meningitis. So that is differential of meningitis. So you can't be a good rheumatologist if you are not a good MD medicine physician.
So you wanted to, have all the body by yourself. You have to treat.
No, basically, I wanted to do DM in internal medicine.
DM in internal medicine. So you wanted, like,
Yeah.
there should be a specialty in that
Yeah,
also.
yeah. So I wanted to do DM in internal medicine. So I was like figuring out, okay, which super specialty will be more like a medicine super specialty. So then I talked to many people. Then I thought that okay, I will do rheumatology. So during that time, we had NEET tests only for rheumatology. Like it was super specialty oriented.
Okay.
So it was not like you learn Harrison again, you get a good rank. Then
now this is like that.
Yeah. So again, there is a problem with it. I get a good rank, then I choose which one I wanted to choose. That is again a wrong way of doing things. But ultimately,
You have to be subject specific. If you are looking for that, and if you are looking, passionate people for in that subject, you have to target.
Yes. But now again, the system is like that. I get a NEET SS rank 1. I am passionate about cardiology. Again, people will come and tell, hey, cardiology is saturated. Why can't you take endocrinology? Why can't you take rheumatology? So the NEET super specialty rank 1 obviously chooses based on the market value.
Market value.
Market value.
We all go for that.
Yeah. We all fall in that trap.
And but we don't, we don't fight for our passion.
Yeah. See, I will tell you, choosing an MD branch and choosing a DM branch, it's like marriage.
Okay.
It's a long-term relationship.
Right, sir.
If you settle for your marriage, like if you hurry your marriage or don't give time for your partner, your marriage life will not be that successful. Right, this is exactly like this. See, you got a good rank. You are choosing something for market value rather for your passion. Do you think that market value stuff will remain with you? No.
Dowry will be finished in few years.
See, whatever it is,
Yes, sir. No, just I'm joking. I'm making this lighter.
Yeah. So that is what. So you have to. So it's like a marriage. It's a long-term relationship. Marriage is not like for 2 years or 3 years. So after your MD or after your DM, just think that you are getting married. It's for your lifetime, because the specialty that you are choosing will remain with you for your lifetime. How can you be satisfied or how can you be happy in your profession if you are not passionate about it? If I am not passionate in seeing patients, how can I be happy at the end of the day?
Right, sir.
So that is why doctors in India, if you see the statistics record, doctors in India are depressed. Doctors are in India are having hypertension. Doctors in India are having anxiety. They are having stress. No one speaks about it. No one speaks about it.
No one talks about it.
Even people who are preparing for MD, DM, they are having so much of psychological issues. No one is bothered to speak about that. Whereas in other countries, your mental health is first. what is the purpose of you becoming a doctor, MD medicine or a DM person if you can't handle, matlab, if you can't handle the stress? But that is unfortunately the system's failure here. No one wants to talk about that. So that is what I am telling you. You might get failure, you might get rejected many times during your exam and all those things, but no, do something that you are passionate. That's what I know. People who are passionate in drawing, who are doctors, it's okay to take one day break and do what you are passionate about.
Right, sir.
If you are not feeling good today, go out for a movie. Do what you feel is more important to you, that can make you happy. So again, it's, don't go that I am rank one, I am this. No, if if those rank one or gold medal doesn't make you feel excited, what is the purpose of going behind that?
Right, sir. Right.
It
Absolute on point.
it might be fascinating for me, but it might not be fascinating for you.
Right,
So
sir.
don't go behind all these things. But if it comes on the way, just take it, accept it,
Accept it.
move on. But don't, just because I am rank one, don't be under the impression that, oh, I have to be also rank one. Don't go for that. Just enjoy the process. Like I told you, my study strategy. If you follow that, I feel that you will get a good rank.
Right, sir. Right.
Who
Right.
knows? You might get rank one. Okay, fine. You might not get rank one. It's okay. But there are so many problems that the Indian doctors are facing right now. We are money oriented. We are this thing. See, money will come.
Money will come. That what I tell everyone in my videos, that money will eventually come. Don't run for that.
If you are passionate, if you are passionate and you are doing your work with 100% passion, dedication, money will come. I told you, know, doctor who is interested in painting, who knows, his or her painting might fetch more money than the daily profession.
Right, sir.
So why to sacrifice your passion for something that you don't love? So money is just a byproduct. And these students now, the new Gen Z students, they are saying that I want to get everything in first attempt. Why wait 1 year? Arey Baba, 1 year is nothing.
1 year is nothing. Yeah. Right. Right.
It's always, see, my generation is slightly an older generation. After MBBS, we used to take a break for 1 year. I prepared, I told you again, I had the luxury of preparing at home. There are my friends who used to go for work, earn money, and then come back and sit and study. Ultimately, they could not make a good rank or they could not get into NEET PG, but still they are happy because they were the breadwinners of their family.
Right,
So
sir.
for them, that was the priority.
The situation was very different.
Yes, but they are happy. Next time they collected money, they worked for 1 year. Again, they sat for 1 year with the money that they have worked.
Okay.
Then they have that. So those people don't have the luxury to again sit for 1 more year.
Right,
So
sir.
they collect money for 1 year after internship. Then they sit for 1 year. Then they get into PG.
Right, sir.
Because their priorities are different. They are the breadwinners. They can't expect their family to support him or her. No, that's not possible. So everyone will have their own problems. It's about figuring out the problem, but always don't get disheartened by the problems. The problem with MD and DM, this thing is, people always think that, oh, getting an MD is big thing. It is a big thing, but it is not the end of
Everything.
your life.
It is not everything.
Exactly. It's all your passion, and it's all your passion and how you look at things.
And I would like to add something, sir. Like, don't compare yourself with
Exactly.
anyone.
Exactly. And I have seen this videos of doctors saying that there is no work-life balance in medicine. Your work should be your life. Absolutely, it's a bullshit statement.
Okay.
Array, you are a hardworking doctor. Okay, I am working. Suppose for those people who say that there is no work-life balance, you have joined medicine for this specialty. You have to work 24 hours. If I work 24 hours for my patients, if I get sick, who will come and sit with me? My patients will come and sit with me.
No.
Who will be there with me?
Your
Yeah,
no one or your family is there.
yeah. So if I don't spend time with my family, why they should come and sit with me? You tell me.
Of course, they will not.
So if I think that I am the person, I am the healer, as you told, I am the healer. My OPD is from morning 8 to night 10, 11. If I go back to my family and if my kids are asleep, I don't have kids, but suppose my kids are asleep, my wife is not there, she has also slept. Why am I working?
You are
So
working for whom?
you will tell that, oh, it's the passion that drives you in your work. There should be a balance. There should be a balance. See, I start my OPD at morning 8 o'clock. If I work till 10 o'clock, I am passionate about doing these things. But there are people who are in their family who wants my time. If I am not spending time for them, you are losing on so many things.
Right, sir.
So all the passion, everything that I told is at a time when there is you are working for yourself. But once you get married, you have kids, you have family, your priorities should change and might change. So at that point of time, you should put a line between, like, there should be a balance. There should be a balance. So your passion, so ultimately, that's what I am saying. Your passion tends to change. When you have a kid, you will be passionate about the kid.
Right, sir.
So you have to give the same amount of time that you have given for your studies when you have a kid also. You can't say that my first passion is medicine, so I will give more time. No, your kid is losing. Your kid is losing the quality time, and you are also losing the quality time with the kid. So it's always work-life balance. That's what in India we never talk about the mental stress or the mental health of doctors. That is very important. That needs to be addressed.
I'm gonna talk about this with one psychologist,
Okay.
and if I'll podcast in near future,
Yeah.
I'm gonna talk about this, sir. And I think we should be like first take care of ourselves, our mental health being.
Correct.
Then it will be easy for us to do everything else.
Correct. Correct.
So, sir, let me ask you one personal question. Like, when did you get married, sir?
Yeah, actually, I married after my MD.
Okay,
So
okay.
basically, I married my batchmate only in MD.
Okay,
So
she's
in
from JIPMER.
JIPMER. Yeah, yeah, she is from JIPMER. So we married after MD medicine only. So then after that, we both of us sat for 1 year. Like, so again, she was.
Okay, you took a year break after your MD.
Yes,
to
exactly.
prepare for DM.
Exactly.
Okay, perfect.
So again, that was not a first time. So yeah.
And sir, no job at that
No,
time.
I for in the 1 year, I used to work for like we had a break for almost like 7 to 8 months because it was after the COVID times. I worked for the initial half.
Okay.
And got some money, and then after that I took a break, and then I prepared.
Okay, sir.
So I collected some money in between, and then I spent that money during the preparation phase. So I continued in JIPMER as SR itself, whereas my wife was not working at that time.
Okay, sir.
She was into studies. So that's it. So again, in DM entrance, I didn't get rank 1. My rank was 32.
Okay, okay, sir.
But still, I managed to get in KGMU. I took KGMU, and I'm not regretting it because I know that the effort. See, you might think I got JIPMER rank 1.
Right, sir.
I got DNB Gold Medalist.
Right,
if
sir.
I was such a studious guy, so much guy, I would have got a DM also rank 1. I didn't get it because I know that I had not prepared well for that exam.
Okay.
And there were people who had prepared better than me for the exam. So I had to accept that I did not. I was not born with a golden spoon. कि जो भी exam लिख लो first आएंगे नहीं. बिल्कुल. I need to show respect for that exam also. I did not prepare well for that exam, and so obviously I did not get a good rank. I got a rank 32, but that was sufficient enough for me to get a DM degree, DM spot. That's it. I chose that.
Okay. Sir, why Lucknow?
Yeah, because
being from Kerala, sir. Yeah. Coming to Lucknow is a drastic change for you. I think.
To be frank, the answer for that is I did not have any other choices because my rank was 32. All the top rankers will choose SGPGA, after that CMC Vellore, then MMC. So the only spot vacant was KGMU.
Okay, sir.
And my wife got in SGPGA.
Right, sir.
So I got in KGMU. So for me, there was no options left. KGMU, my rank was 32, and I was the last ranker in KGMU. So below that, it was MMC and all those things. So I had no choice. So I had to settle for it. So if you want to say no language, I settle for it. But I don't consider it as a settlement only.
Okay.
See, if you think like that, oh, you might be thinking that, oh, this guy is rank 1, why to settle for? It's okay at that
circumstances.
Exactly. At that point of time, I thought that it's okay for me. So again, I am thinking because sometimes you tend to feel, no, oh, if I would have sat for 6 more months, I would have written ESS, I would have institute, I would have joined in PJ Chandigarh. But I don't think like that. See, at that circumstances, that was the best decision. You took the decision, move on. Then don't think about it. Like, and oh, you chose it.
Live by it, you accept it, and you work for it.
Yes, yes. So that's what I'm coming to you. See, after joining DM Rheumatology, in this field, you do what you can.
Right.
You be best in your specialty. Like my interest is slightly different. I do project on infrared thermography, neural imaging techniques, and all those things. I have gone to many international conferences, so I try to do what is best at this point of time. So I've gone to US for a conference, I've gone to Australia, I've gone to Japan. So after joining rheumatology, you try to make a footprint in that specialty by doing work,
Right.
by doing things passionately.
Right, sir. Right, sir.
So that's what. So I don't think that, oh, I only got a rank 32, whereas in SGPJ there is rank 1, rank 2. Those people will be doing better job. It's okay, leave it. You do what is possible from your side, from your perspective.
Yes, sir.
That can take you to a different level. So
Sure.
that's what. So wherever you are, do your job passionately. You might not get it in the first time, you might not get it in the second time, but you need to take decisions based on that circumstances, based on your perspective. Don't change your perspective, don't change your passion based on the market value, or not based on what others say. That would be the end of it.
So, are you happy right now, sir?
That's a very good question. See again, that is the perspective that I have about happiness.
Right.
My happiness might not be happiness for other person.
No, but sir, are you happy right
Yeah,
now?
I'm completely happy now. I'm
Okay.
completely happy now because I am a person, as I told you. What was your first question, sir? 20 years
20
back.
years back.
Yeah, exactly. 20 years back, I was a student who knew where I would go ahead or this thing. The only thing that I knew is that if I am given a work, I will try to do it the best. If I am into a sport, try to do better in that. That will give you happiness. See, now I am in this post. So trying for me, happiness is like doing what I like to do. So that will make me happy. If I want to do something like I want to go out and have food, I will have that. I will be happy. Seeing patients, if that gives me happiness, do that, get happiness from there. That's it. So going back home early, spending time with my wife, if that gives me happiness, do that, be happy.
Sir, ma'am कहाँ से?
Actually, ma'am is also from Kerala only.
Kerala only. Okay,
So
okay.
now she's
So,
in SGPJ. Yeah,
love marriage.
love marriage. Yeah,
Oh
proper
my
love marriage.
goodness. Like, UG में भी तो सर आपकी गर्लफ्रेंड होगी पक्का.
UG में
Though
तो
you were the superstar, like you were into everything.
that's the problem. When you're into everything, people come to you for all the help. People used to come to me for their love advice, but no one. Just on joking.
But sir, it was fantastic talking
Yeah,
to you.
yeah,
I
sure.
would like we will talk more about like in DM Rheumatology things
Yeah, sure.
in next podcast,
Yeah,
sir.
sure, sure.
And sir, it was lovely having you
Yeah.
on my podcast. Thank you so much,
Thank
sir.
you.
And I think it will help many of students and will impact their perspective.
Yeah.
And lovely having you, sir.
Yeah.
Thank you so much,
Thank
sir.
you very much. Bye. Thank you. Nice
Thank you,
meeting
sir.
you. Thank
Thank
you.
you, sir.
Bye.